Hello everyone, so welcome to another video of the AMDP system. We discussed consciousness before, and now we're discussing the orientation. Orientation is very important part of checking for psychiatric pathologies, and it gives us hints for whether there is a organic brain injury. Organic means if there is, for example, intoxication, if there is a medication that can cause disturbances in the mental health of the patient, if there is infection, and inflammation that has to do with the central nervous system and the brain in particular, and um, and this is called basically organic brain injuries. But in psychiatry, there are also cases where when a patient with psychiatric disorders, they experience a lot of external stress, emotional stress. They can also have some orientation disorders. It's good to ask these questions basically to almost any patient that comes to you, or any patient that you see that they're unstable mentally, because they're very short, very directed, and it doesn't take more than 1 minute or 2 minutes to actually ask them. So, as I mentioned before, AMTP system 100 psychopathologies, extra 40 for somatic, so bodily dysfunction pathologies, plus 14 extra questions, and these are part, of course, of the psychopathologies. So, 4 items. The first item is item number 5. This is the time, so the orientation for time, disorientation for time. And then we have number 6, it's for place. And then we have number 7 is for the situation that the patient is found in. And 8 would be the own person. So what questions would you ask? Very simple. The first question for item number 5 would be what day is it in the week? So you ask the patient, what day do you think in the week is it? We can also ask about what months, what year are we in, and the patient usually will be able to answer it if there's no any problems in the orientation, and we can grade it by the fact that sometimes we also are confused about the day of the week. If there's only 2 day deviation between the actual date in the week and the date that the patient says, it still can be considered as a light disturbance or not disturbance at all. But if you give the patient one more chance to say, and he is very off in explaining what day of the week is it, so it would be a severe disorder. Then we go number 6. Number 6 would be, I say, the place. Place, basically we ask what city the patient is in at the moment, what country, and the patient usually will be able to answer it if there's no problems, organic problem or extreme stress. If the patient will not be able to say exactly which city they are in, but after giving hints, he will be able to do it. It will be, of course, a light grading, light disturbance. But if he will not be able, totally not be able to answer this question, it will be a severe grading scale. Then we'll have situation. This is item number 7. And basically, the patient will be able to identify in which institution or in which actual functionality of the location that is found in. So, for example, most patients, they are coming to our hospital. We are expecting them to say, I am in a psychiatric hospital. If you ask this for a patient that is in the mall and you see that he is confused and is in an unstable mental state, if he'll be able to tell you, yeah, I'm now at the mall in, I don't know, Zurich Central Mall or something like this, then it means good. The patient is oriented in place, in situation, sorry. So it can be confusing to think like it's a place, but actually the situation is what's important here. And then we have the last one, it's number 8. It's for the own person. So here, this is the personal information of the patient that he would know about himself. So this would be his name, full name, his date of birth, if he's married and has children, the number of children he has, the name of the children. So personal information that the patient is exposed to on a daily basis is part of his identity. And this, if we take all these items together, so time, location, situation, and personal information, the personal information is usually the last one to be affected. So this is something that's so ingrained in us that it would be hard for you to forget who you are. And that's why when this one is disturbed, you can expect the other ones also to be disturbed. The good thing about this is usually it's most of the time it's due to organic brain problems. So, and after the organic brain problems are resolved, this quickly regains back, and the patient will be able to remember who he is, how many children he has, the date of birth, and this comes very quickly. The rest of them may take a little bit of time, depending on the situation and what is the cause of the disorientation of the patient. So for the grading of the item number 8, light form would be if the patient will not be able to answer one aspect of his biography. So if he is not able to talk about his job, so what kind of job he has, but the rest is okay. He can say the date of birth, he can say how many children he has, he can say his full name, then to be a light form. So if only one aspect and it's relatively not such big part of the personality of or the biographic information of the patient, then it would be a light. If the patient is totally confused, not able to answer any of these questions, or important part of his biographical information will not be able to be answered by him, that would be a severe form. So, just to summarize, the first thing to go away usually is the time. People can forget that or not be disoriented to that. Then the place, then situation, and the last is the person. Yes, I think that's about it about this disorientation, so the psychopathologies of orientation. I hope it was helpful, and see you in the next one.